Welcome to Mary Immaculate Hospital's Patient's Guide to Spine Surgery. My name is Debbie, and I'm your nurse navigator. I want to thank you for choosing Mary Immaculate Hospital to help restore you to a higher quality of living after your spinal surgery. This presentation will help to outline the surgical process, from getting ready for surgery all the way through recovering at home. The goal is to provide clear expectations regarding your orthopedic care. You play a key role in ensuring a successful recovery. Our goal is to involve you in your treatment through each step of the process. Your education and compliance will help to ensure a safe and successful surgical outcome. Please feel free to contact me by email or call my office before or after surgery if you have any questions. I've listed my email and my office number here. Pre-Operative Education Book. All the information presented in this seminar can be found in the Get Ready for Spine Surgery book. If you did not get a copy of the book from your surgeon's office when you scheduled surgery, don't worry about that. When you finish watching this seminar, you can go back out and you'll find an area where you can download a copy of the book. If you'd like to follow along in the book as we go through the seminar, go ahead and stop this seminar, get back out, download a copy of the book, and then play the seminar again. There is more information presented in this book than will be presented in the seminar, so please read the book. When you have completed the seminar, please go back out to the Preoperative Education page and click Complete the Survey. Once you complete the survey, I will get a copy of that and put a note in your chart so that your surgeon knows you watched the spine education seminar. If you have any questions, you can ask me those questions through the survey and I will reach out to you by email or phone number to answer your questions. About your spine surgery. On pages 6 and 7 in your pre-op book, you will find general information about your spine surgery. For more detailed information about your surgery, please speak with your surgeon. Pre-anesthesia testing. Once you and your orthopedic surgeon have agreed that surgery is the best option for you, your surgeon's office will send information to our pre-anesthesia testing department regarding your surgical procedure. From here, you will be scheduled for a pre-operative nursing interview. You will receive a phone call from our pre-anesthesia testing staff before your surgery to schedule your nursing interview. During this important nursing interview, you will be asked to share your medical history, surgical history, allergies, including both foods and medications, and your daily medications, including vitamins, herbal supplements, and anything over the counter. That would include topical medications also. Be sure to have the bottles available for this interview so that you can provide the medication name, dosage, and frequency. Your personal medical history will determine what preoperative testing you will need before surgery. While your nursing interview must be scheduled, your medical tests can be completed without an appointment. Please complete these within 30 days of surgery. Common tests include lab work, which is non-fasting, meaning you can eat and drink prior to the lab draw, an EKG, a potential chest x-ray, and/or a urinalysis. The results of your testing will be sent to your surgeon, and you will be contacted if the test results are abnormal. It is also best to undergo a complete physical examination with your family physician within 30 days of surgery. Your surgeon will let you know if this is a requirement. If you have any high-risk conditions or see a specialty doctor, you may also be required to obtain surgical clearance from these physicians, such as a cardiologist and a pulmonologist. Medications. During your PAT interview, a nurse will review with you what medications to stop, when to stop them, and what medications you can keep taking. Please make sure you have paper and pencil and write down the instructions, as it's easy to forget what they tell you as you wait for surgery. Herbal supplements and over-the-counter vitamins. Please stop these 14 days before surgery. Non-steroidal anti-inflammatories, also known as NSAIDs, need to be stopped 10 days before surgery. For examples of what NSAIDs are, please refer to your preoperative education book. Anticoagulants, also known as blood thinners, and diabetic medication. Please talk to your surgeon and prescribing physician on when you should stop your blood thinners and what you need to do with your diabetic medication before surgery. Daily medications. Please make sure, again, you write down what the pre-anesthesia testing nurse tells you so that you remember what to do with your medications that you take every day. Pain medications. You can keep taking the following pain medications: Tylenol, also known as acetaminophen, oxycodone, Percocet, hydrocodone, Vicodin, Norco, Tramadol. If you have questions, please contact our PAT department at 757-886-6411. COVID testing. Mary Immaculate Hospital's COVID testing policy is constantly changing based on the CDC guidelines. Contact your surgeon's office or our pre-anesthesia testing department at 757-886-6411 if you have any questions or need clarification. Get ready for surgery. Start by picking a coach. A coach can be a friend or a family member, but should be someone who is available to help you the first few days after surgery. If you're going home the day of surgery, you need to have someone stay with you for the first 24 hours, so make sure you have those arrangements made before you come to the hospital. Stop smoking. Smoking increases the risk of lung complications during and after surgery, and it decreases your ability to heal. If you aren't ready to stop smoking, try to cut back 2 weeks before surgery and refrain from smoking the night before or the morning of surgery. Stop alcohol intake, or at a minimum, limit your alcohol intake at least 2 weeks before surgery. After surgery, please check with your surgeon before you resume drinking alcohol. If you're taking narcotics, muscle relaxers, or any medication with Tylenol in it, please do not drink alcohol. Eat healthy. Eating healthy is important for healing after surgery. Maintaining a healthy diet helps you bowels to work, helps you to have energy to do the things you need to do to recover, and it promotes healing. Prepare and freeze or purchase small portioned healthy meals for times you may be alone. Keep moving. Do your best to keep as active as possible as you wait for surgery. The more active you are coming into surgery, the better your recovery will be after surgery. Set up your home. Make sure you pick up throw rugs or anything that could trip you. Rearrange your furniture so you can easily walk around places. Put night lights in dark hallways. Make sure that you have handrails that are secured, that your toilet is elevated so you can easily get on and off of it, and that you make arrangements for any pets, as they can be a tripping hazard. Get these things before surgery. You'll need stool softeners as you take narcotics, so make sure you have them before you go to the hospital. Make sure you have ice packs. Purchase your front-wheeled walker and bring it with you to the hospital, as Mary Immaculate does not provide walkers. If your surgeon has asked you to get a back brace or a neck collar, please get those before surgery and bring them with you the day of surgery. Cleaning your skin 3 nights before surgery. You should get your CHG bathing solution from our registration department when you come for your pre-op testing. If you did not get the CHG bathing solution, call our pre-anesthesia testing department at 757-886-6411 to find out where you can get the CHG solution. For instructions on what to do, look at pages 12 and 13 in your pre-op spine book. Countdown to surgery. Please look in your preoperative spine education book to find a detailed list of the things you should be doing as you wait and get ready for surgery. I'd like to highlight a few things for you. 4 weeks before surgery, make sure you've scheduled your preoperative physical and that you have your preoperative lab work and tests done. 10 days before surgery, make sure that you stop any medications that you were instructed to stop by your physician. Please make sure you've checked about NSAIDS and blood thinners and know when to stop those. Stop or cut back on alcohol intake and smoking. Make sure to get your back brace or your neck collar if you've been instructed by your surgeon to purchase one, and also make sure you have your front-wheeled walker. 3 nights before surgery, start your skin preparation, and you can find detailed information on what that means in your pre-op book. The day before surgery, make sure you drink plenty of fluids and that you eat a snack before you go to bed. Remember, nothing to eat or drink after midnight. The morning of surgery, again, do not eat or drink anything, but you can take any medications you were instructed to take the morning of surgery with a sip of water, and you can brush your teeth. Going home after spine surgery. Your surgeon may be planning on sending you home the day of surgery. If you're not sure what the plan is, please ask your surgeon if you'll be going home the day of surgery or staying overnight. Things to bring with you the day of surgery. Front-wheeled walker, as the hospital does not provide those to you, CPAP machine, and glasses and denture case. Where and when to come the day of surgery. You'll get a call from your surgeon's scheduler a day or two before your surgery telling you what time to report to Mary Immaculate and where to come. You can find a detailed map and written instructions in the back of your pre-op spine book. Pre-op. When you come in and check through registration, you'll be taken to a pre-op room where you will be wiped off with the CHG wipes, and your nose will be swabbed with a nasal antiseptic. You'll put on a hospital gown and get under a warming blanket. All of this is to help prevent infection. Your vital signs will be checked. Your medical and surgical history will be reviewed. The nursing staff will go over what medications you took the morning of surgery and the last time you took your regular medications. You'll have an IV put in. You'll meet with your surgeon and your anesthesiologist, and any medications ordered by your surgeon or anesthesiologist will be administered in the pre-op area to include antibiotics if ordered and fluids for hydration. If you have problems with anxiety, please let the anesthesiologist know so that they can give you something to help you calm down. Anesthesia information. You will meet your anesthesia care team, which consists of an anesthesiologist and a nurse anesthetist. They are responsible for your comfort and well-being before, during, and immediately after your surgery. They will meet with you before surgery to discuss your anesthesia plan for the day. It will be based on your health history, medications, and your personal needs. Decisions regarding the type of anesthesia and medications used will be made by your anesthesia care team. Please make sure to let them know if you've had any problems in the past with anesthesia, including if you easily get nauseated. General anesthesia will be used for your spine surgery. Your anesthesia care team will put you to sleep using an anesthetic gas. Once you are asleep, they will insert a tube into your mouth and lungs to breathe for you while you are sleeping during surgery. They will give you medications through your IV during surgery to help prevent nausea, pain, and make sure you remain asleep until your surgery is done. With this type of anesthesia, you will be unconscious throughout your procedure. As you awaken and are taken to the post-anesthetic care unit, medications will be given to help alleviate post-operative pain. Surgery. Once it is time for your surgery, the OR team will take you by stretcher to the OR. you will be assisted to slide onto an OR table. You will have monitors applied to your body while you are asked to breathe in oxygen to get ready for anesthesia. Once you are asleep, the OR team will conduct a timeout to review your information and consents to make sure you are safe for surgery. If you want to know how long your surgery will take, make sure you ask your surgeon before surgery. Post-anesthesia care unit. Once your surgery is over and you start to wake up, you will be taken to the PACU, also called the recovery room, where you will continue under the care of your anesthesiologist. Your vital signs will be observed closely as the effects of anesthesia begin to wear off. Early on, you may feel dizzy, sleepy, or confused. It is not unusual to be groggy for the remainder of the day. After you have been deemed stable by your anesthesiologist, you will be moved from the PACU to a room where you will recover under the care of your surgeon and our nursing staff. If you are going home the day of surgery, you will be taken to Phase 2 discharge unit. You need to have someone stay with you the first 24 hours at home because of the anesthesia in your system. If you're spending the night, you will be moved to an inpatient hospital room, and your family will be told where you are. What to expect after you wake up from surgery. Pain tolerance. Pain is a normal part of recovering after spine surgery. Your care team will work with you to help you have pain tolerance. Pain tolerance means you'll have pain, but you can still change positions, walk, dress, and bathe yourself. Please set realistic expectations for yourself so you don't get frustrated after surgery. For back patients, you'll feel like a horse kicked you in the back. For neck patients, you'll have a sore throat and feel like there's a lump in your throat. This is normal after surgery. Ways to manage your pain include prescription, narcotic medication, non-narcotic medications, ice, changing positions, distracting your brain from thinking about the pain like watching TV, maintaining any back or neck precautions you're instructed to maintain, getting up and walking every hour short distances to decrease the stiffness and soreness in your neck or back. Sequential compression device and support stockings. These are used to promote circulation and to decrease swelling or prevent swelling in your legs. The sequential compression device will be put on while you're sleeping during surgery. When you wake up, you may have them wrapped around each one of your calves. These will squeeze air to the lower part of your legs, promoting circulation. Support stockings are white, tight pantyhose, basically, and they're to be on your legs during the day. You can take them off at night, wash them, hang them up to dry, and put them back on in the morning, but you are to wear them till you go back to your surgeon's office and they instruct you when to stop wearing them. Incentive spirometer. This is a plastic machine that helps you to take deep breaths and exercise your lungs to prevent pneumonia and prevent you from running a fever. You'll be expected to do this 10 times an hour while you're awake until you go back to your surgeon's office for your first post-op checkup. Back brace or neck collar. If your surgeon has asked you to get a back brace or a neck collar before surgery, you should wear them as instructed by your surgeon. Occupational therapy and physical therapy. You will see an occupational therapy person and a physical therapy person before you go home. They will work with you on bathing, dressing, toileting, safely walking in the hallway, taking the stairs, and any precautions you have with your back or neck. Medication review. Pain medications. Your surgeon will be the one to determine what medications you will go home on for pain management. Please speak with your surgeon before surgery so you can discuss what the plan is before you come to the hospital. If you see a pain management doctor, please make sure your surgeon knows that you are seen by a pain management doctor so that they can let them know that you're having surgery. Stool softener. Please make sure that you have stool softeners and laxatives at your house after surgery so you can start taking them when you get home. Narcotics and anesthesia do cause constipation. If your bowels do not move 2 days after surgery, then you need to take a laxative. Home medications. Your surgeon will decide what home medications you can keep taking and which ones you should not continue to take. NSAIDs are not allowed to be taken after spine and neck surgery until your surgeon gives you permission to do so. Outpatient pharmacy. We have an outpatient pharmacy located here in the medical pavilion for your convenience so that you can get your prescriptions before you leave the hospital. This does not obligate you to have any refills done here at the hospital. Preventable complications. Blood clots. The best way to prevent a blood clot is to get up and walk short distances every hour, change positions from sitting and lying, and make sure that you move your feet so you promote circulation to the lower part of your body. Constipation. Please make sure you're taking a stool softener and/or a mild laxative and drinking plenty of water, as narcotics and anesthesia can cause constipation. Pneumonia. The best way to prevent pneumonia is to get up and move, but you want to use your incentive spirometer 10 times per hour while you're awake, or take deep breaths and cough 10 times an hour. Infection. Please make sure to keep your incision dry. Do not put lotions, creams, or powders near your incision. Shower as directed by your surgeon, but it's very important that you wash your hands as often as possible. Drains. Your surgeon may put a drain in your neck or back to drain the fluid that may accumulate right after surgery. If you stay in the hospital, your surgeon will tell your nurse when to remove the drain. If you go home the day of surgery with a drain, don't worry. The nurses at Mary Immaculate Hospital will teach you how to empty the drain before you go home. Keep your neck or back brace on while you have the drain in place. The day after surgery, your surgeon will either have you come back to the office or they will arrange for a home health nurse to pull the drain. If you get home with a drain and you're not sure what to do, please call your surgeon's office the morning after surgery. You do not want to keep a drain in longer than your surgeon tells you to. If the drain stays in too long, it can cause a possible infection. Home health care. Our goal is for you to recover at home, continuing your physical therapy and any other related care in familiar surroundings. Home health services, which may include a physical therapist and a nurse, is ordered by your surgeon before surgery if they think you'll need this. If your surgeon is planning for you to go home the day of surgery, your surgeon's office will have arranged this care before surgery. If your surgeon is planning for you to spend one night in the hospital, our care manager will visit with you to make sure your home health is arranged. Tylenol or acetaminophen for pain. Remember, 10 days before surgery, you're going to be asked to stop any NSAIDs you might be taking. NSAIDs are helpful when patients are having bone pain in their back or in their neck. However, NSAIDs do thin your blood out, so you have to stop them coming into surgery. Many patients want to know what they can take before surgery as they wait. You can safely take Tylenol if you don't take anything else for pain. You want to make sure that you look in the pre-op book so you're familiar with what medications contain Tylenol and what medications do not. It also instructs you on how to safely take Tylenol. You can take 1 extra strength Tylenol every 4 hours or 2 every 8 hours. If you have Tylenol arthritis, you can take 1 every 6 hours. Again, check to make sure any other medications you're taking do not contain Tylenol. NSAIDs after fusion surgery. Please do not take any non-steroidal anti-inflammatory medications, including pills or creams, after your spinal fusion surgery. It is safe to take Tylenol/acetaminophen as you recover from spine surgery. For any questions about when you can resume NSAIDs, please speak with your surgeon. Neck or back recovery book. Please make sure you have a copy of this book, Safe Recovery at Home, before you leave Mary Immaculate Hospital. This book will have plenty of information on what you can do to safely recover at home. Also make sure you read through your discharge paperwork, as your surgeon will give you specific instructions that are for you as you recover at home. Again, thank you for trusting Mary Immaculate for your spine surgery care. We look forward to meeting you and helping you on your road to recovery. Please don't forget, once you close out this seminar, to go back to the top of the education page and fill out the survey. If you have any questions, please make sure to ask them in the survey. Also, make sure you provide me with your email address and a phone number so that I can reach out to you. Thank you.